Welcome.
Thank you, Madam Chair. Thank you very much. Madam Chair, members of the committee, AJR 17, HIV/AIDS health disparities. It's a pleasure for me to make a statement regarding this AJR. Minority communities are facing disproportionately high rates of HIV and AIDS infections. In California, for example, African Americans account for roughly 6% of the population, but 19.4% of the state's HIV cases are reported by name, and Latinos in California account for 28% of all AIDS cases reported by name, and Asian Pacific Islanders have been identified by the CDC as an emerging...
Excuse me for a moment. If we could have it quiet, please. Sound really carries, and I can hear the conversation even in the back, so thank you very much.
Thank you, Madam Chair. As an emerging risk for HIV and AIDS, in the wake of the recent cuts to HIV funding in the state budget, federal resources have become more important than ever before for HIV and AIDS programs in California. AJR 17 is designed to highlight HIV and AIDS-related health disparities and ask the federal government to direct more resources toward addressing the HIV and AIDS crisis in our communities of color. I have witnesses that will self-introduce, Madam Chair, and I would ask them to do that at this time.
We have we can do 2 witnesses, 3 minutes each, or some subset of that. Yes.
I think that's fine.
Welcome.
Good afternoon, Madam Chair, committee members. Chad Silva, Latino Coalition for Healthy California. You've pretty much heard the numbers. I just want to pretty much reinforce the idea that the fact that California is the second highest HIV/AIDS incidence rate in the United States after New York. An estimated 190,000 people were living with HIV in the state of California as of April 30th, 2009. And that's including those with and without AIDS. That's including HIV positive and those suffering from AIDS. This joint resolution becomes all the more important because 2009 will be the Ryan White reauthorization year. And so this resolution will help to reinforce the fact that we need to reauthorize that and that we need to address the disparities among the minority populations in the United States and California especially. Because of this and because it is so prevalent among Latinos and African Americans, we urge you and I vote on the joint resolution.
Thank you.
Madam Chair, my name is Thelma Harris. I represent GlaxoSmithKline Pharmaceutical Company. We are one of the world's largest producers of HIV/AIDS drugs in the world. Not only do we recognize the need for treatment of HIV/AIDS, we recognize the need for education and prevention. As I sit here as an African-American female, which is the largest group that is leading the pack in HIV prevention, I urge you to please give an aye vote to this resolution, and I thank you.
Thank you.
Yes.
Other witnesses in support?
Thank you.
Maxine Mantell on behalf of the Southern California HIV Advocacy Coalition in strong support.
Thank you. Witnesses in opposition? There's no opposition.
Okay. Thank you.
Questions, comments from committee? Would you like to close? And as you know,
Yes.
we do not have a quorum yet, so we're not
Yes.
able to vote on it yet.
Yes, thank you, Madam Chair. I would like to say that many families in California are affected by HIV and AIDS. No one is exempt from this. Not too many years back, I lost my younger brother to AIDS because of complications developed as a result of HIV. And so it's a wake-up call for everyone that, in fact, we have to work together to find solutions. And so I ask for your aye vote.
Thank you very much.
Yeah, thank you.
I understand that the Republicans are still in caucus. I will wait 4 more minutes, and then I will begin presenting the bill for Speaker Bass.
No, we just had it too close to the side.
We are going to have Senator Alquist present Assembly Speaker's bill, AB 1422.
Thank you, Madam Chair. Chair and members, AB 1422 will help avoid disenrolling 670,000 low-income children in the state's Healthy Families Program and will remove the current waiting list through 2010. The Healthy Families Program is California's version of the federal Children's Health Insurance Program. I was very pleased back when I was in the Assembly to be a co-author of this legislation. It provides health, dental, and vision coverage to children in families. Yes. The Vice Chair has arrived if he would like to chair the meeting. It provides health, dental, and vision coverage to children in families with incomes generally between 100% to 250% of the federal poverty level. California receives a 2-to-1 match from the federal government for every dollar spent. Due to the state's fiscal crisis and the resulting general fund reductions, the Managed Risk Medical Insurance Board, Mr. MIB, requires approximately $194 million in order to support the Healthy Families Program. The program has been closed to all new enrollments since July, and absent a solution, will begin disenrolling children in October based on their annual enrollment date. Several stakeholders have worked closely to find a shared solution, and these pieces are contained in this legislation, AB 1422. On behalf of the author, Speaker Bass, I want to thank the health plans, the State First Five Commission, Mr. Mibb, our pro tem Senator Steinberg, and the governor for coming to the table to find a solution. Specifically, the bill does 3 or 4 things. One, the bill extends the 2.35% gross premiums tax to Medi-Cal managed care plans until January 1st, 2011. The gross premiums tax will generate approximately $157 million, which will then generate approximately $97 million in additional federal matching funds that will be given to healthy families. All the plans that will be paying the tax are in support of the bill. The State First Five Commission, in a unanimous vote, pledged up to $81.4 million to cover the state share of premium for children aged 0 to 5. This bill additionally provides the State Commission the ability to transfer unspent funds into the unallocated account upon approval of the State Commission. Next point, enrollees will face increased cost sharing. For example, beginning November 1st, 2009, for families with incomes between 200 and 250% of the FPL, the federal poverty level, premiums are increased by $7 per child per month, from $17 to $24, with the maximum family contribution rising $21 from $51 to $72 per month per family. Mr. Mibb intends to increase co-pays for emergency room visits, brand name drugs, and non-preventative care visits. The bill provides emergency regulatory authority to Mr. Mibb in order to institute these changes. This bill is supported by a broad coalition, as you will see, representing the health plan community, the administration, and the consumer and children's health advocates. Toby Douglas, the State Medi-Cal Director, is here to answer questions on behalf of the administration, and Dan Chick from HealthNet is here to answer questions related to the plans.
Thank you, Madam Chair. Toby Douglas, Chief Deputy Director, Department of Healthcare Services. The Department strongly supports AB 1422. What this bill does is continues the quality improvement fee that our Medi-Cal managed care plans have been paying over the last several years, which is a 5.5% fee on their revenue. It continues it by including the managed care plans as part of a general purpose tax, the gross premium tax, and thereby allows us to assess a tax of 2.35% on them. By doing this, we free up $97 million in new revenue that can go to the Healthy Families Program, thereby preserving the Healthy Families Program enrollment. And finally, the administration supports this because it encompasses shared responsibility by adding components to the Healthy Families Program that increases the premiums, the co-payments, and making sure that families are part of the solution to continue to preserve the Healthy Families Program. So again, we strongly support this bill. Thank you.
Afternoon, Senators. Dan Chick with HealthNet. We're pleased to be here today to support 1422. We think it's a common sense approach where all parties can come together to rescue the Healthy Families Program and avoid some of the devastating cuts in enrollment that are likely to occur unless we get a solution. As far as one of those entities that will be paying this tax, for us this is a mere continuation of an existing fee, albeit about half as much as what we were paying before for a very limited time till 2011. We are already equipped to handle this new structure as far as our administrative burdens, so for us it's not much to meet the requirements of the bill. We also want to emphasize that as far as our commercial business is concerned, there will be no additional premiums charged to our commercial clients. It stays within the Medi-Cal business, the Medi-Cal line.
Mr. Chick, can I cut you off right here? I believe we have a quorum, so if Secretary, if you can call the roll and establish a quorum.
Senator Alquist.
Here.
Alquist here. Strickland. Here. Strickland here. Onnested. Here. Onnested here. Cedillo. Here. Cedillo here, Cox. Cox here, DeSagne. Leno. Maldonado. Here. Maldonado here. Negretti McLeod.
Here.
Negretti McLeod here. Pavley and Woke.
Quorum's established. Mr. Chick, please continue.
And our final point I'd like to make is that I want to thank the author of the bill as well for including several safeguards in the language to ensure that the tax would become inoperable in the instance in which the federal government fails to come up with the match. It gives us a much higher level of comfort with the bill. And in addition, the tax would become inoperable if in the event that the money is used for anything beyond the Healthy Families and Medi-Cal program. And with that, we're really pleased to be supporting the bill today. Thank you.
Thank you, Mr. Chair. Thank you, Mr. Chair and members. Nick Luizos with the California Association of Health Plans. We are also in support of the bill. Our trade association represents all of the Knox-Keene licensed health plans, and we are essentially the industry that would be the focus of the tax provision in this bill. Essentially, the way this would work, and I don't want to get into much of the testimony that's already been discussed here, this would only apply to our Medi-Cal managed care lines of business. As such, we want to emphasize that consumers in our commercial markets will not see or feel the impact of the extension of the gross premiums tax to that line of business. We also believe that the bill does contain many of the safeguards that have been mentioned, including a sunset date on the extension of the tax, and it is also part of a larger effort involving funding sources from other sources, and it is also coupled with changes to the programs that will lead to other needed savings. We want to thank the administration. They've worked hard in resolving some of our technical issues, and we look forward to working with them on some implementation issues if and when the bill is enacted into law. But we support the bill. Thank you.
Natalie Cardenas on behalf of Anthem Blue Cross in support for the reasons already stated.
Thank you.
Maureen O'Haron representing Access Dental and Molina Healthcare of California in support for the reasons stated. Thank you.
Thank you.
Jim Gross on behalf of the Local Health Plans of California, which are the 9 statutorily created health plans that provide services to Medi-Cal and healthy families in support of the bill.
Thank you.
Nicole Wortelman on behalf of the City and County of San Francisco as well as the Alameda County Board of Supervisors. This bill would prevent 7,500 children in San Francisco from losing coverage, which would otherwise cost the city $5.5 million.
Terry Calgar Hill on behalf of the 100% campaign in Pico, California, representing the children. We are in strong support of this bill.
Thank you.
Elizabeth Landsberg with the Western Center on Law and Poverty here in support.
Thank you.
Beth Capel on behalf of Health Access here in support of this measure. Pleased to be working with you.
Thank you.
Jason Gappar on behalf of the Host Association of California Life and Health Insurance Companies.
Tahira Bazil, California Primary Care Association, in strong support of this bill.
Trent Smith on behalf of 4 county organized health systems, including Cal Optima, Partnership, Central Coast, and Health Plan of San Mateo, in very strong support.
Chad Silva, Latino Coalition for Healthy California, in strong support.
Bill Worley with Kaiser Permanente in support.
Catherine Reese representing CenCal Health, which is Santa Barbara and San Luis Obispo counties, serving Medi-Cal and Healthy Families population we support.
Any witnesses in opposition? Questions from members?
Move the bill.
The bill's been moved. Secretary, call the roll. Oh, hold on. No, I asked for questions. You have Okay, I'm sorry. Senator Cox has some questions. Thank you.
Mr. Chairman, I will, in fact, today give a courtesy vote to move this bill out of this committee. There are some things I'm concerned about. I'm concerned about some of the optional benefits that are in fact, in this bill that I have concerns about. And so I need to have further information about that or clarification that they are in the bill or they're not in the bill. And to the extent that they are, it would preclude me from voting from this bill on the floor tomorrow, I presume, is when this will come up. I am, frankly, excited about the fact that First Five Commission has agreed to put a significant amount of money in this project, even though I don't think that Ms. Alquist that it's sufficient based upon the account balances that are up and down this state. Let me just give you, if I may, And Mr. Chairman, I won't take too long, but let me just tell you there's $2.5 billion in fund balances in the 58 counties and state commission. $2.5 billion. When we took a look, by the way, at Los Angeles County, they had $882 million reserve. San Francisco, $26.9 million. Santa Clara, Ms. Alquist, $86.9 million in balance. San Diego, $196.6. Sacramento, right up there with 104. And when you take a look at the June 30th, 2008 audited financial statements for the first 5 commission, they actually have $407 million in their reserve account. So I do feel as if we have made some progress, but if the bill that we had passed early, that I had in committee early on had been passed, all of that money would have been available for this kind of program, and we wouldn't, frankly, have to be asking anyone for a contribution. But I will give you the courtesy of a vote today to move it on, recognizing tomorrow, Ms. Alquist, that if we can't get the answers to the questions that have been proposed, then I would in fact be a no vote. And I rather suspect, by the way, that there would not be 27 votes on the floor of the Senate to move this bill out, unless there's some concessions that can be made or some clarifications. So just wanted to put that out on the table.
Senator Alquist.
In closing,
Sorry.
In closing, I'd like to thank my good friend Senator Cox for his comments, because you are a good communicator, and for your work and your concern in this area. In closing, I would just like to say that I think my first sentence or two really said it all, that AB 1422 will help disenrolling 670,000 low-income children who are already in the Healthy Families Program, and will remove the current waiting list through 2010. Ask for your support.
Senator Alquist.
Aye.
Alquist, aye. Strickland. Onnested. Cedillo. Cox.
Aye.
Cox, aye. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado.
Aye.
Maldonado, aye. Negretti McLeod.
Aye.
Negretti McLeod, aye. Pavley. Woke. It's got 5. Needs one more.
That bill has 5 votes, needs one more.
Thank you very much.
Now that we have a quorum, would someone like to entertain a motion on the resolution? Yes. It's been moved by Senator Gloria Negrete-McLeod. Madam Secretary, can you call the roll?
Senator Alquist. Aye. Alquist, aye. Strickland. Onnested. Cedillo. Cox.
Aye.
Cox, aye. DeSaulnier. Leno.
Aye.
Leno, aye. Maldonado. Aye. Maldonado, aye. Negretti McLeod. Negretti McLeod, aye. Pavley. Woke.
Strickland, aye.
Oh, Strickland, aye. Onnested, aye. It's got 7 ayes.
That has 7 aye votes. It is out. Well, we'll put it on call for a moment till a couple more members come. There she is. We'll wait one more minute, and then we will vote on both the AJR and the Speaker's bill.
We're done.
Oh, thanks. Good job. Okay, well, we're going to do it in 1 minute. If they're not here, they're not here. We'll do both. Okay. Oh, thank you, Martha. Thank you. Yeah, 65, senior citizen. You're young. All right, we will do the vote one more time on both the AJR and the Speaker's bill.
Item 1, AB 1422. On the motion, do pass to appropriation. Senator Strickland. Onnested. Cedillo.
Aye.
Cedillo, aye. DeSaulnier. Pavley.
Aye.
Pavley, aye. Woke.
That is out. It has 7 votes. And then on the AJR, please.
Senator
Item 2.
Cedillo?
Aye.
Cedillo, aye. DeSagne? Pavley?
Aye.
Pavley, aye. Woke? It's got 9.
That has 9 votes. It is out. Meeting is adjourned.